Natalya, can you tell us about yourself?
Sure, with pleasure. My name is Natalya Butakova and I'm the CEO for AP Group of companies. And I've been working in the industry for over 20 years, cost containment, TPA, travel assistance, and similar services.
Great, thank you. And can you tell us why ITIC Americas is so important for you as a business?
Well, we as AP have been coming to ITIC Americas for a number of years now. And as being a global TPA company, we have to be aware of all the current trends, changes, and particularities of different geographies. So ITIC Americas has been a highlight when it comes to understanding the healthcares in Latin America, understanding the requirements and expectations of the payers, insurers, and the best way how to manage your cases in this region. So by far, ITIC Americas has been serving the purpose for AP to be on top of our trends and to deliver the best for the clients.
Great, thank you. You spoke at ITIC Global in Barcelona in November about travel trends from the viewpoint of assistance companies and TPAs. Can you tell us what the changes in the expat landscape and the increase in digital nomads have meant for your business?
Well, I would say that expats have been changing. They have been starting to relocate to some new locations in terms of countries they go to. Also, the assignments have become a bit shorter compared to the pre-pandemic times. There is a big number of exactly digital nomads now living across the globe, and they definitely have some new requirements and expectations. Well, one of the examples is that this population is much more tech savvy, so they appreciate having apps, having digital access to the networks. They are not in favor of making telephone calls when they need medical care. They like to be prepared in time. They like to understand exactly where they go to get planned or emergency medical care. They also very conscious about staying healthy and keeping healthy, so checkup networks is very much catered to their needs and interests. So we have seen that that's an upscale of trends in this respect and try to meet their expectations accordingly.
Great, thank you. And now that travel is back and even exceeding pre-pandemic levels, what has this meant for business and are there new challenges?
Well, indeed, I would say that from AP point of view, we have seen that the travel is back to the pre-pandemic levels. I would like to make sure that, or mention that the shift has been made more for tourist travel rather than business, as a number of companies have cut back on their travel business expenses, and they have not really got back on the road their employees and try to replace it with remote education, trainings, meetings, etc. While travelers definitely pick up on traveling across the globe. For AP, it has been one of the challenging things as to meet the destinations they go to, because now it's very popular to travel not to the mass touristic destinations, but rather some unexplored places, remote places, searching for, nature reserves or some truly unique experiences, travel experiences. So that was and has been one of the challenges of developing the networks and meeting their expectations. And on another side, while we brought back the volumes of travel business at AP, we tried not to bring the number of people who used to service them. So we try to be much more cost efficient by bringing some of the communication channel online through the app, through the portal, so that we can be very cost efficient and save on the human resources and manage it in a more cost efficient way.
Okay, great. What has inflation and the rising costs of healthcare meant for AP companies?
Well, AP has been known for its cost containment efforts and expertise, so essentially inflation globally has meant that we have even more work to do, because our clients have always expected us to manage the medical care well, and in this respect inflation is hitting across the board, or providers across the world, not because providers want to make more money, but they have to respond to the increasing cost of the medication or supplies or other things which they need in their day-to-day work. So we at AP have been looking for alternative solutions of how to approach that healthcare management in a different way. And as an example, we have implemented steering some of the clients through the telehealth consultations as an initial triage to identify whether a hospital visit is needed or it's just a prescription refill, and that could be easily met and done and managed in the most cost-efficient way by only paying the telehealth consultation. We have also been working on identifying those centers of medical excellence. And we have done that in cooperation with our providers, because different providers have different strong departments or specialties they specialize on. And we have been identifying those providers which are most cost efficient, willing to accumulate patients for a specific procedure, and steering the members towards those specialized providers. And of course, we do traditional contract negotiations, we do utilization management, etc. But then we have to search for those innovative ways together with the providers to find a solution as an industry how to mitigate those increasing costs of inflation.
Okay, great, thank you. Telemedicine is already hugely important. What other tech changes do you see on the horizon?
Well, I think my response would be quite predictable, and artificial intelligence comes as a second in mind after telehealth consultations and telehealth medicine. Well, having said that, artificial intelligence is a big topic, but different companies have been implementing certain parts of it. It's still lacking a lot of regulation on how to use it, what's the liability for using that tools and artificial intelligence programs and implications from that. So that will keep developing, and as better regulation will be put around it, more companies will be empowering it within their structures. Aside from artificial intelligence, I would mention that it's not really technological development, but I think it's in general management of the cases will be impacted by better access to the medical health records. And there are, of course, a lot of questions around personal medical history protection and data protection, but we have seen already on the countryside levels, there has been a lot of efforts or changes which are being made in order to accumulate information about the person's health, treatments, medications the patient is taking, past medical history notes, which is important to know for the travel insurance companies. So by accumulating it in specific way, which can be accessible primarily by the member or insured member, who can then share it accordingly with the insurance company or with the hospital where he or she is getting treatment, that should overall bring a better results in terms of accessing medical care, managing preventive care, doing the checkups, providing emergency treatment, as provider would have immediate access to all the allergies, to all the past medical history treatments, and be able to deliver more efficient and quick help to the patient. So I do trust that countries will continue to work on creating the databases or creating the ways to access that information, at least at the national level, which potential would be able to be shared internationally with the consent of the patient, of course. But that will be a big work to be done, and that will give a lot of advantage in terms of delivering the best medical care and saving efforts for a number of players in the healthcare industry.
That's great, that's so interesting. Thank you so much for sharing your insights today and for joining us at ITIC Americas.
Thank you very much, my pleasure.